I'm Carla Macias, and welcome back for another episode of Best Dogs Network featuring Forest Park Medical Center right here in San Antonio, Texas. In the next 30 minutes, we're going to take a look into some of the amenities at Forest Park, as well as meet some of the physician partners who are changing people's lives. Now let's get today's show started by introducing San Antonio plastic surgeon, Dr. Stephen Pisano.
This is the second time for me to have breast cancer. So the diagnosis wasn't totally surprising. Since they already done the deep flap, then we had to look at what was the alternative. And so the alternative was to do the gluteal flap. I chose an immediate reconstruction because it just made sense to, while you're in there doing the surgery of the mastectomy, why not go ahead and do the reconstructive at the same time? I have a wonderful oncologist who, when it came time to say, what do we do about surgery, I asked her and she immediately said, you need to go to PRMA.
Here at PRMA, we are able to perform a wide variety of tissue transplant reconstruction techniques and options. We're certainly known for the DIEP flap, or the deep flap, as we say. However, we frequently bring into play other tissue reconstruction options. So in particular, the gluteal flap. The gluteal flap can be taken from the upper buttock or flank area, which we call the superior gluteal flap, or it can be taken from the lower gluteal area, we call the inferior. So it's S-gap and I-gap. Most commonly, I would perform the S-gap operation, the upper gluteal area. Even in a thin person, there's typically enough tissue that can give us some good volume for a breast reconstruction.
Today I feel good. I let things be in the past and look forward. I'm very pleased with the results of the procedure. It's a natural looking breast. It feels natural. I met with Dr. Pisano afterwards, and he actually commented that it was the best results that he had seen through the gluteal flap. The PRMA staff have been really good to work with. The consultation with Dr. Pisano, he answered all my questions. The whole experience with that group has been very positive for me.
Many of our patients are coming to our practice because the routine options are not available. So we in the practice are expert at bringing into play a variety of other areas of the body to give us tissue to do the reconstruction.
What's been so rewarding for me to be involved with Forest Park is that I've been in the business of helping physicians manage hospitals for 25 years, and I have seen all the various models that have been associated over that period of time. I've been involved in many different kinds of models, and it's been a pleasure for me to implement the model that I think works the best in this business, and that is the majority physician-owned model where the physicians are in control and govern their own hospital and have business partners like me who come in and help them run that business. But we focus on running the hospital the way that the unique aspects of that medical staff wants their hospital to be run.
With the help of the doctors here and at all of our hospitals, we recruit the very best people in all different lines of work, from the OR technicians, the floor nurses, the quality directors. Everyone who walks through this hospital has been very carefully considered. This basically gives our patients the best possible experience. They walk into this place and very quickly are eased of a lot of the stresses of surgery that you get in a cold, sterile hospital environment. The people are very friendly, the place is very welcoming all around them, and of course the quality of care is unsurpassed.
What Forest Park means to a physician is that it provides a place for that physician to practice medicine where he or she is much more in control of their destiny, much more in control of the atmosphere that they practice medicine in. We provide our physicians with dedicated teams of nurses in the operating room who become familiar with the type of surgery that the physician does. That makes the surgery go much quicker, enables us to get the room turned over quicker between cases so that the physicians can get more cases done. All of the physicians that I talk to tell me that they are able to get more cases done and in a more efficient manner than any other hospital they practice medicine in.
As a physician, a surgeon actually practicing here, we start your cases on time. Our turnover is very efficient. We have top quality staff to provide you with the people and the equipment necessary to really be state of the art in everything you do.
Did you know eating oysters can keep your immune system strong? A 3-ounce serving has a quarter of your daily iron intake plus twice the zinc you need in a day. Orthopedics is the branch of medicine concerned with conditions involving the musculoskeletal system. Dr. Siraj Sayeed is an orthopedic surgeon here in the San Antonio area. Now let's meet the doctor.
I'm an orthopedic surgeon, and I have subspecialty training in adult reconstruction or total joint replacement surgery. I'm the president and co-founder of the South Texas Bone and Joint Institute. Our mission at South Texas Bone and Joint Institute is to personalize orthopedic total joint care for each patient with compassion and integrity. Once I graduated medical school, I went on to my orthopedic residency training at the Mayo Clinic in Rochester, Minnesota. At the Mayo Clinic as a orthopedic surgery resident, I fell in love with the field of adult reconstruction, total joint replacement surgery. I performed my fellowship training in Baltimore, Maryland at Sinai Hospital, the Rubin Institute for Advanced Orthopedics, one of the prestigious total joint replacement programs in the nation.
Forest Park Medical Center has won many awards over the past few years. Recently, they were awarded for being one of the most beautiful hospitals in the country. One of the many attributes that makes this hospital so aesthetically pleasing is the art. Up next, we're going to take a look into the art selection process for Forest Park, San Antonio.
Select Art I started about 28 years ago. It's a private gallery, and I specialize in providing art for public spaces and primarily doing hospitals and MOBs. And over the 28 years, I've probably installed over 100,000 pieces of art. This is my love and passion in life. My overall goal for Forest Park is to make each space unique and come up with new art concepts for each facility. So what I do is generally I start several months ahead of time once I know a facility is coming about. The art should support the design of the space, very similar to if a man buys a nice suit, then his shirt and tie should support his suit, and a lady's handbag, jewelry, and shoes should support the dress that she selects. So art's kind of like that. It really needs to coordinate and support the design of the space, yet each piece is an individual piece of art. The art for Forest Park, San Antonio, I had a brand new sculptor. The folks from San Antonio were the first to see his work, and they actually selected one of his freestanding pieces of sculpture for their facility. It's a really cool kind of a teal blue steel torso of a body on a pedestal in this really unique kind of teal blue color, and that's going to be a featured piece in San Antonio. One of my artists does this hand-blown glass with a metallic finish, and they were the first facility to really have this, metallic blown glass. San Antonio got a number of new pieces that I hadn't shown before. Each facility seems to get better, and even though we think the last one we did was the best one, the next one we do seems to get even better. It's exciting for all of us to put a great art program together. And, and the day of the installation is when it all comes together. And so we get it all there and we get it placed and installed, and then it's like magic. Everything all comes together and it's like, wow, this is great, and people are excited and they're lit up, and we get compliments, the day we install it from the employees that are around, and, it's a win for everybody. So, yeah, we all just keep moving forward.
Patients who are good candidates for a robotic partial nephrectomy are those with tumors in their kidney that can be removed without having to take out the entire kidney.
The initial problem was that I had had a routine CAT scan by my family practice doctor, and they discovered in the CAT scan a tumor. They came back with a tumor that they thought it was most likely malignant in the kidney. So they sent me to a urologist in my local hometown, and that urologist looked at the scan, showed me the scan, and said, because of where that tumor is located, I believe that I need to take your entire right kidney out plus your adrenal gland. So I thought about it for a day or two and then said, I'm going to get a second opinion. And that's when I ended up going to Dr. Wyatt.
I looked at the imaging and it looked like a rather challenging case, but definitely possible. So she was a good candidate for a partial nephrectomy. Now there's two ways to perform partial nephrectomies. You can either do it with the traditional open approach, which requires about a 10 to 12 inch incision, which goes across all 3 layers of the abdominal musculature, or you can do it robotically with 4 to 5 incisions and potentially reduce the morbidity involved, or at least the pain and the discomfort with the surgery.
The recovery was very easy. I was out of the hospital after about 3 days, and I went back to work after a week. I think a whole lot of Dr. Wyatt and his staff. It's reassuring because he continues to have me come back to have these CAT scans done. Because, as he explained to me, one of the reasons we were so successful with this surgery was because we were having those CAT scans and we caught it early. I feel great today, and I don't even have any scares. When I come to get these scans, I'm not scared. You know, a lot of people don't want to do that because they're afraid of what the results are going to be. But now I am glad to do that because I want to know sooner than later, because I know that something can be done about it.
The Makoplasty is a robotic adjunct for joint replacement. It's good for inside of the knee, the outside of the knee, or combined inside in what's called patellofemoral or underneath the kneecap arthritis.
It's relatively advanced technology that helps increase the precision of the surgeries that we do. A lot of the orthopedic surgeries in the joint replacement field have a lot to do with measurements and alignments, amounts of cartilage and bone that we remove in order to replace either that exact amount or some variation.
The ideal candidate for Makoplasty is anyone who has usually mild to moderate arthritis that's confined to one. There's basically 3 compartments in the knee: the medial or inside compartment, the lateral or outside compartment, and the anterior compartment, which consists of a groove called the trochlea and the patella.
So having technology in this situation with Mako using the robot, which helps you to execute the plan that you have preoperatively to achieve a certain result. The robot is actually helping you during surgery. But a big part of the technology is the information that we get from the computer system with the preoperative study to help plan the surgery before we ever make an incision.
How Mako is different from the standard partial knee replacement is the excellent reproducibility of putting in the implant. One of the more difficult things about doing partial knee replacements is getting the implant in a good position and maintaining the soft tissue structures. The way the Mako system works with the CT, we do a CT scan and it tells us we can set exactly where we want our resection level to be, the exact angle of the implant, and it's 100% reproducible from our plan based on the CT scan. It's impossible to have that done any other way than with the robotic surgery. It will literally stop you from making a mistake.
Overall, Makoplasty knees are a significant improvement on a partial knee replacement that we've done for many years, and because it's done better and more precisely, it allows us to open up to a larger potential group of patients and get better short-term and long-term results.
It's literally the minimum of minimally invasive surgery for knee replacement.
Forest Park Medical Center is a different kind of hospital, designed for Warren, designed for comfort. Forest Park Medical Center is your destination to better health. By visiting bestdocsnetwork.com, you can browse through our doctor specialties and video gallery where you can find the right doctor for you. One of those doctors you can find on our website is San Antonio Pain Management Specialist, Dr. J. Ellis.
The first problem that I had was I had toe surgery, and when I came out of it, I was in complete pain. Morphine, nothing could take it away in the hospital. And so my podiatrist decided to call in a pain management person, which was Dr. Ellis.
The most challenging patient I've had in my 30 years of clinical practice is a lady who has a degenerative disease of her nerves, which causes severe pain.
It's like my immune system is attacking my nerves. The trouble is we don't know why. Sometimes it gets so bad you just want to get rid of it any way possible.
This is an extremely high-functioning individual, college instructor, former All-American athlete, who, when she gets these episodes of pain, they are incapacitating.
My first meeting with Dr. Ellis was in the hospital. I was explaining the pain to him, which is hard to explain nerve pain, but he understood in my screaming when he decided that radio frequency really hadn't been used that much yet, but he thought we'd go ahead and use it.
And then with the help of neurosurgeons here in town, we've been able to actually heat the nerves with a technique called radio frequency.
Dr. Ellis said that the radio frequency procedure would actually burn the tissue of the nerve and that it could regenerate. And so he went into the foot and burned the nerve, and it got rid of it completely. Today, I'm fine. I still have neuropathy pain in different areas, but Dr. Ellis knows exactly what to do.
This is such a challenging problem that we're never afraid to ask for help, and we've referred her to other facilities across the country. And they all send her back to us with the same thing: keep doing what you're doing. Control her pain when nobody has anything else to offer her.
After the radio frequency procedure, I get up, I leave, there's no residual effect whatsoever. I can drive, I can go back to work, I can do whatever I need to do. And Dr. Ellis has been a godsend. He's literally saved my life.
In 2010, Haiti suffered a big earthquake. I think it was 7.0 on the Richter scale. And it was devastating for a couple of reasons. It's the poorest nation in the Western Hemisphere, and the infrastructure is really poor. The buildings don't have codes for earthquakes or anything like that. So when the earthquake hit, I mean, everything just fell apart. And then being economically poor, they really don't have the infrastructure to respond to any kind of emergency like that. They don't have ambulances and fire trucks. They don't have construction equipment all over the place. So it was very difficult for them to respond to that. So one of the first responders, if you will, to the situation was a medical team from Forest Park Medical Center. They went down to provide medical assistance in evacuating people, triaging people, and of course providing treatment, bringing doctors and nurses and supplies and equipment. That, in conjunction with one of the charities down there, turned into a regular visit where with Sacré-Cœur, which is the hospital down there, we would send a team and participate in surgeries on a regular basis. They would get patients that needed surgery ready. When the team arrived, they'd spend a week basically operating day and night to treat the cases that otherwise would have been too complex to treat in Haiti. So in the United States, we have a very robust system. It's very refined. There are safety protocols everywhere. Everything's disposable, so nothing gets reused. But in Haiti, it's the polar opposite. You're operating in a hospital that's an open-air hospital. There's no air conditioning. The one air conditioner that is in the hospital is in the operative suite because under gowns and stuff it gets very hot. But it's a window air conditioner. The air's not filled. The instrumentation is very basic from the 1960s. Everything that they have is something that's been designated from a first world country. Well, this is a great opportunity to do what doctors really want to do. I mean, this is why you become a physician, because you have this overwhelming compassion anytime you see somebody that is hurting or is sick or is in pain, you want to help them no matter, what it takes. I mean, sometimes it becomes a downfall, but in this situation, you're able to go to a country and really give them something that they really never had access to. And in 100 years, they probably wouldn't get to it because it's such an economically poor country. I mean, when you go there, you see it's open sewer systems, the water they get out of the mountainside basically running down, and who knows whether it's clean or not. Again, the infrastructure is terrible. The buildings are half completed. There's no disposal system. Trash is everywhere, and it may not have been like that before the earthquake, but certainly it is now. They have basically paralyzed all the infrastructure to the entire country. We're able to go in there and just help with those situations, using the expertise that we have. Well, Forest Park has really been, I think, a leader in helping out. When this disaster occurred, of course, there were other hospitals that sent back teams, and there are other hospitals around the United States that sends teams as well. But in the Metroplex, Forest Park has been the one that's routinely gone back to help out, to bring supplies, to lean on our vendors who have been very helpful in when we upgrade our equipment, for instance, we can take that and use that for the Haiti missions. It's shown a remarkable sense of leadership and a remarkable sense of the responsibility that it is to be in the healthcare field for Forest Park to go down there and participate the way they have, not just initially, but on a regular basis.
As a state-of-the-art medical facility, Forest Park Medical Center is unrivaled. So, naturally, it's where the finest physicians in North Texas want to work. And because of the extraordinary level of comfort and care provided to our patients, Forest Park Medical Center is where they prefer to come to. We're just happy we could bring them together. Come experience for yourself what medical care was meant to be. Forest Park Medical Center, your destination to better health.
Forest Park Medical Center is a one-of-a-kind healthcare facility. Up next, we're going to take a virtual tour of this incredible Melanie has a question for Dr. Ramon Reyes. What can I do to prevent osteoporosis?
Young ladies have to take calcium, drink milk when they're growing up, because the more you drink milk, the more you take calcium supplements, the more bone you're building through your young life. So when you start losing bone at the menopause, at 50s and 60s, you have a higher bone and you can lose more because now you have more bones. The other issue is to exercise. If you exercise, you improve your bone health. The other issue is not to drink a lot of caffeinated products, because coffee decreases the quality of your bone.
And that'll wrap up this week's episode of Best Docs Network featuring Forest Park Medical Center, your destination to better health. If you're ready to request an appointment with any of the doctors you've seen on today's show, head to our website, bestdocsnetwork.com. We love hearing from our viewers, so if you have